Hi, my name's Kylea and I'm an oncologist. And what that means is that I treat cancer. And I'm here to tell you some really exciting news, which is that we are making great strides in cancer. We have incredibly intelligent and motivated scientists that are studying this disease and discovering new things about it every day, about why it happens, how it happens. And because of that, we're learning even better how to treat it. The exciting thing about these new treatments we're developing is that they are helping our cancer patients live longer lives, more rewarding lives, better quality of life, and we're even starting to cure more cancers. The real downside to this, though, is that we can't afford all of these treatments. Right now, we live in challenging financial times. Many people are hurting personally financially, but our governments are hurting too. They can't afford to fund every cause or every drug, and that's where we come in as a society. I want to tell you a story about a young woman. She was a patient of mine. Her name was Tanya, and she was a beautiful 32-year-old woman when I met her. She has a wonderful family. She had, at the time, a beautiful 8-month-old son, and she also had a lump in her breast. For the longest time, it was thought that this lump was an infection because in that situation, that is most commonly what it would have been. But over time, it became apparent that this probably wasn't the case, and she ultimately needed surgery. When the surgery was done, it was clear this was not an infection, it was cancer. When Tanya came to see me, we treated the cancer. Myself and a team of other specialists worked so hard on her for months and months and months. We worked with her and her family. She went through all different kinds of chemotherapy. She went through radiation. She went through major surgery. Ultimately, all for nothing. The cancer kept growing. And it was because it was a very rare and very aggressive type of cancer. At the time, there was a drug that I wanted to try for Tanya. It's a drug that we don't normally use in breast cancer, but this wasn't a normal breast cancer. It was a drug that showed effectiveness in other types of cancer that were very similar to the one that Tanya had. I lobbied the government, I lobbied the drug companies, I lobbied everybody that I could, and so did her family. We went for weeks and weeks, and during this time, Tanya got worse. She got weaker, she couldn't hold her son, she could barely take care of herself, and finally she ultimately ended up in hospital with us. The day that her husband came to us in the center and had the money for us to try this treatment was the same day that Tanya died. This story, this woman, her situation will live with me for the rest of my life. And I could sit on my hands and decide to do nothing, and every time a situation like this comes up, feel the same way, helpless. But I decided not to. I decided we need to take action. It always just starts with one person, one situation, and that's what happened here. So I developed a fund called Act Now, and I haven't done it alone. I've been working with an amazing team of people who share my passion. And what we have done is we've developed a special charitable fund that is for this kind of situation, to help pay for drugs that aren't funded by the government, that aren't funded by any other source, but might help patients with cancer. This is a situation we're seeing more and more in oncology. It's a problem that's going to get bigger and bigger. We're going to face it more every day. There are many of us that are very blessed in life, especially here in Canada. We have good jobs, we have good quality of life, we have good health coverage in Canada. But even the most blessed of us are not immune from getting cancer, and even the best government programs can't pay for everything. I want you to remember Tanya and her story. I remember her every day in my practice. It's only through our own generosity that we're going to be able to help each other through these most difficult times, to improve each other's life. Sometimes I'm not asking for a cure for my patients. Sometimes we're just asking to get them that extra bit of time that they can be with their families and not like Tanya, in pain, suffering, and in a hospital bed. So if you're here at the site, I'm asking you now, pass Tanya's story on to other people. Pass this website on to other people. Go to the Donate Now button and do what you can to help us help our community members, our loved ones, our families, our friends. I thank you for listening to this story. So please explore the site, think about Tanya, and donate as generously as you can from your heart for your community, for your family and friends.